My name is Hannah Smith, and I'm redoing the non-parenteral medication administration. This is my badge. I have case study number 1, and I'm showing my mark. I plan to give 3 medications. The first is meloxicam, 15 milligrams. I know that I need to compare that to my MAR. And this is my 3rd medication check, as I've done the first and second one in the back preparation room. So meloxicam is 15 milligrams PO. Meloxicam 15 milligrams. Metoprolol 50 milligrams PO. Metoprolol 50 milligrams. And then I also need to give fluticasone nasal spray, and it is 1 spray each nostril. Fluticasone nasal spray. And then I'm showing my MAR one more time. And that was my 3rd medication check. I'm knocking on the door, closing the curtain for privacy, hand hygiene. Hello, my name is Hannah, and I'm going to be your student nurse today. Do you care to tell me your name and date of birth? Sandra Anderson. The patient's wristband is different from what is stated on the MAR, so I would make sure that the patient stated the correct birthday that is on the MAR, and that's how I know I would have the correct patient. And then I would make sure I get them a correct wristband that displayed their accurate birth date. If I did not have the right patient, I would not proceed with my med pass, and I would go to find the correct patient. While I'm here, can you please tell me any allergies that you have? They don't have any allergies indicated on the MAR. I would make sure that my patient didn't tell me of any allergies they knew of, and if they did, I would make sure that it was properly documented on the MAR and they got a wristband to tell their allergies. Okay. I have some medications that I need to give you today, and in order to give those medications, I need to raise the head of your bed up a little bit, and I'm going to have to raise your head up to a high position. I'm putting the patient in high Fowler's position so that they are not at risk for aspiration. Are you able to breathe sitting up this high? Make sure that they said yes. I got a cup of water for them to take their medication with. Hand hygiene. Alright, do you care to turn your head away from me and cough? Making sure that they have a strong cough, able to cough up any medicine that they may have accidentally inhaled. I'm going to feel their throat. Can you take a swallow for me? Okay. Making sure that they have a good swallow reflex. And then I'm also getting a tongue depressor and checking their gag reflex. If they pass all 3 of these tests, I know I'm safe to give PO medications. first medication I have for you is your meloxicam. It's 15 milligrams, and this is to help with your arthritis and keep your pain level low. Let me give you the pill. Sip of water. I'm documenting that medication. I also forgot to say, but I really already did it, the 6 patient medication checks. I know that I need to, which I already have, the patient identifiers, making sure I have the correct patient, the correct dose of the drug, the label compared to the MAR, the right drug, making sure it's the right reason, and it's the correct drug based on what the MAR indicates I need to give. I'm documenting after each medication that I administer. I'm making sure I give it the right route, so when the MAR says PO, I know it's by mouth. And then also the right time, so the MAR, I know I can give medications an hour before or an hour after. And for PRN medications, I know that if it needs to be given after the amount of hours that are allotted. So if it's every 6 hours, I have to wait until those 6 hours are up to re-administer the medication.
The locations that I could give this is the Deltoid, the Salmonella, so I can give it in the Deltoid, the Fuel, or the Vascular. So find the Deltoid, I go to my clinic, process.
Now I have your metoprolol. Before I give this medication, I would do a double check of the blood pressure and the pulse, just so I make sure I don't drop their blood pressure too low, drop their heart rate too low, and cause harm to the patient. The vital signs were okay in the MAR, or on that assessment that I did, but I would probably recheck them one more time just to be sure. This is your metoprolol, and it's to help with your high blood pressure. Here's the pill. And there's you some water. Now for the fluticasone, I know that this is for nasal decongestion. I'm going to, since I cannot actually administer the medication to the patient, I'm going to explain to you how I would do it. I'm going to lower them into semi-Fowler's position. And I'm providing patient education on how to properly do this medication. So before we get started, I'm going to have you practice your breathing exercise. Whenever I administer this medication, you're going to take a big sniff and hold your breath for a few seconds, and then you're going to exhale through your mouth. Okay, so I'm going to have you tilt your head down like you're reading a book. I'm going to plug the opposite nostril of where I'm administering medication, putting the applicator in, straight back. And on the count of 3, I want you to take a big sniff in. 1, 2, 3. I would administer the medication, have them sniff, hold your breath for a few seconds, and then you can exhale slowly through your mouth. I would wait a few minutes, and then after about 5 minutes, I can administer on the opposite side, doing the same protocol that I just listed. Plug their nose, administer the medication while they take a big sniff in, hold their breath for a few seconds, and exhale through your mouth. If there's any drainage, I know that I can dab that away with a tissue, and I'm just going to have you not blow your nose and try not to sneeze for the next like 5 or so minutes, just so you get all the effects of the medication. I'm gonna put that down. I can lay your head back. Just tell me when to stop for when you're comfortable. Alright, you have your call light to call me if you need anything. And some of these medications can make you a little bit dizzy, so I'm just going to go ahead and put your bed alarm on. And make sure that you press your call light and just let me know if you want to get up to go to the bathroom or anything, and just let me walk with you just to be sure. Since I just gave the fluticasone, I'm going to stay in the room for a few more minutes, make sure that I monitor their respiratory and cardiac systems. Just make sure they don't go into anaphylactic shock or show signs of cardiac or respiratory distress. After a few minutes have passed and I know that they're okay, they didn't have any adverse reactions, I'm able to leave the room. Do hand hygiene one last time before I leave the room. They have their bedside table. And I am going to show you guys my, I'll lift this up just a little where you can see. I'm going to show you my MAR where I documented after each medication. And then one final documentation at the end to sign off. My name, credentials, and initials.